everyone. I'm Claire Heffernan. I'm the director of LIDC and the PI of the Action Against Stunting Hub. And we are absolutely delighted to welcome you to just this event today on contingency planning on COVID-19. So I just thought I have a few just brief kind of points to make before we start. I think it's fair to say that COVID's really posed an unprecedented challenge to the research community. And I equally think it's fair to say that the academic community wasn't particularly prepared for COVID. And we're not alone. I don't think anybody could have predicted how rapidly COVID has transformed the globe from being in 1/3 of the globe currently into lockdown, to travel declining by 2/3, to millions of people being unemployed, to on top of the really deleterious health impacts. And all of this happened in a matter of weeks, certainly in the global in the West. So it's not that we're not used to detailing risks in research. I think most research projects tend to, at the application stage, have to list their risks. And some funders are better than others at insisting that, that we keep risk registers. But I think prior to COVID, a lot of the force majeure risks that would dutifully get listed on risk registers wouldn't get that much attention. Many researchers just never thought that these things would happen. So we didn't spend a lot of time thinking about what these risks were. So I think it's fair to say that the level of risk posed by COVID is not something that many academics have an extensive amount of experience with, except there's one group of academics and practitioners, and those working in the humanitarian sector. And they do have a lot of experience working in contingency, and they do have an understanding of this space, and they do have an understanding of when things change so very rapidly. So we thought today we would draw in our experts from across our college that work in this space, and just to talk about their experience in contingency planning, to see if we can glean some insights to best practice, and equally to see what we can learn from each other. So our first speaker is Professor Bayard Roberts from the London School. Welcome, Bayard. And by way of introduction, he is the co-director of the Center for Global Chronic Conditions at LSHTM. And his research explores the health determinants, policies, and systems of countries experiencing major social change, such as armed conflict and forced migration. He's the PI of the RECAP project, and I'm sure he'll tell us more about this. It's a GCRF, large-scale GCRF project, which strengthens capacity of the health sector to improve decision-making in response to humanitarian crisis. So welcome, Bayard.
Thanks very much, Claire, and thank you for organising this, and to Alicia as well, and to everyone joining today's session. I'm just going to, I prepared a few slides, so I'm just going to share my screen. You can all see the PowerPoint slides now? Yeah, good. Yep. So as Claire said, I'm the principal investigator of the RECAP project, which is a GCRF funded project under the GROW cohort of projects that started in January 2018. So we're quite a fair way into the project, which has probably helped in a way our ability to cope with and respond to COVID. The focus of the project, as Claire said, is conducting research and associated capacity strengthening to support responses and preparedness to humanitarian crises and epidemics. And this slide shows the countries where we're working. So the core partner countries are Lebanon and Sierra Leone. So we do some research in those countries and quite a lot of capacity strengthening. And then we're working in quite a large number of other countries, some of which are shown here, and also some additional ones, where we're doing quite a lot of research and also some additional capacity strengthening. And we're working with a number of universities, both here in the UK, shown here, but also in Sierra Leone and Lebanon. And we're also working with quite a lot of international humanitarian NGOs. And this lists out a large number of work packages that we have in the project, it's very broad and diverse, which brings strengths and weaknesses to the project. And so the first 6 work packages shown here are really focusing on research. And particularly the first 2, I guess, have most relevance to how, in a way, we've been able to respond to COVID, particularly the second one, which is focused explicitly around modelling epidemic preparedness and responses. And I'll come back to some of the work that they've been involved with. But we've also been able to bring in some of the other work in the different work packages to COVID responses. And then the last 4 work packages are really around training and capacity strengthening amongst ourselves and partners and other stakeholders. And as with a lot of GCIRF projects, there's a big focus on interdisciplinary research. So in terms of the impact of COVID-19 on RECAP, I think it's fairly predictable response. I'm sure we'll hear similar stories across the different projects, really. So in effect, almost all of our field research has had to be paused. So almost all the countries that we're working in are experiencing some form of lockdown, which is preventing research taking place. And that's also included randomized controlled trials, which will have a longer term impact on those particular studies. As I said earlier, we're working with a lot of humanitarian NGO partners, and as Claire rightly said, their strength and their skill is being able to respond to crises. That's what they do. And so that's been a strength for the project and for us, but it's also meant that they've absolutely had to prioritize their work in responding to this crisis and the major concerns that there are about the spread of COVID-19 into refugee or internally displaced person settlements, where the idea of social distancing is completely impossible. And so a lot of the focus on how can we stop the spread into those settings. And so they've been having to absolutely prioritize that rather than perhaps some of the other research that we've been working with them on. While the field research is paused, there's no reason why we couldn't be doing desk-based qualitative research, for example, with key informants. So we have some of our work has been around those sorts of qualitative interviews with key informants that we could in theory do from London, from Beirut or Freetown and so on with key informants. The big challenge is the key informants have much better things to be doing than speaking to us in qualitative research, because many are involved in the responses to COVID. So we have to respect that, and that's obviously going to be delaying our ability to do that. We had a number of training workshops planned. They've been delayed. We also had our annual management meeting where we were bringing everyone together this year. They were coming to London from all the different partners and partner countries. So that's been cancelled. And while we've tried to find ways around that, which I'll come on to, it was really a missed opportunity where we can learn what we're all doing. We had some training sessions planned around it and other activities. And so a lot of that face-to-face interaction we've lost for an indefinite period of time. So it is a loss. There's also a danger of kind of loss of momentum of projects. With RECAP, we're kind of halfway through, so things are fairly well progressed. But I'm also PI of another GCR project that started just in February in Lebanon. And we're having to work quite hard to make sure that the project started, that we can keep it going. COVID doesn't mean it should be stopped or paused in this particular, for this other project, but we just have to make sure things can carry on in terms of some of the formative work. A broader concern that's not specific to RECAP is this sense that journals and potentially funders are only prioritizing COVID-related research and publications. And of course, it's a huge issue at the moment, but I think we have to be careful not to lose sight of all the other really important research and issues that are taking place. So I think that's a sort of a concern that we have going forward. I think on a kind of more personal note, I know colleagues also feel a sense of pressure that they somehow have to be responding to COVID and reorienting their work and somehow helping with the COVID response. And I think we have to be careful to protect kind of researchers' well-being and others, that they have an enormous amount of work anyway, and particularly dealing with the impacts of COVID, let alone then feeling compelled to how do we help respond to COVID. So I think we have to kind of have realistic expectations of what we can do as individuals and as projects. And then in terms of managing uncertainty, I put here a few examples of things that would help and are fairly predictable. Absolutely, we need funder support and understanding and flexibility in how the projects are going to have to change. And along with that, changing expectations from the funders. And also, I think, flexibility around timelines. So obviously around no cost extensions, but ideally, predictably, we'd like cost extensions. We are having to then work through revising our own project plans and financial forecasts, particularly if there are extensions of some kinds. And then working remotely and then reorienting activities to actually support COVID responses. And I'll just come on to those last two points in my next slide. So this final slide is looking at the ways in which RECAP and some of the other projects I'm involved with can actually respond to support responses to COVID-19. And so the first one is having to find new ways of working remotely. One of the positives coming out of COVID-19 is the fact that we cannot travel, and we've realized that actually we probably don't really need to travel as much as we all thought we did. And there are alternative ways of working, particularly using remote management, holding remote seminars and training sessions that often can be as effective as face-to-face ones. And like we're seeing now, probably the attendance is much greater. Certainly management meetings that we hold within the university are far better attended now than they ever were when they were face-to-face meetings. So I think there's real opportunities there. There are opportunities which we haven't implemented yet, but we're thinking through about conducting remote research using phone or online surveys. But clearly that raises a number of methodological challenges, particularly related to sampling, equity, and certain populations being excluded from that research, and the quality of research, and ensuring good ethical and data management procedures. Then secondly, I think one of the opportunities coming out of COVID, and predictably coming from a School of Public Health and related to RECAP, is we're pleased that there's greater recognition of the importance of public health and emergency response. Obviously, there is going to be so for epidemics and pandemics, but I think one of the spin-offs from this is also perhaps greater recognition of some of the impacts of epidemics on other aspects of health. So, for example, mental health. And for this other GCRF project I work on in Lebanon with the National Mental Health Programme in Lebanon, we worked on a paper recently just on really the ways in which the COVID response there, including the lockdown, has actually led to some positive developments in mental health system strengthening. So, for example, moving people out of overcrowded psychiatric institutions, which has really accelerated the process of deinstitutionalization of mental health care patients. There's been acceleration of training for healthcare workers around mental health responses and the public. So there's been some really important developments that have only really taken place as a result of COVID. And I think there's also greater recognition of the need to address NCDs because of their relationship and underlying conditions with COVID. And these were traditionally perhaps ignored in humanitarian settings. So I think it's led to some kind of refocusing on previously neglected issues. And finally, point number 3 here is just giving some examples of the way in which we've tried to reorient RECAP to support responses to COVID-19. Clearly, we're in a strong position to be doing so, and we should be doing this, given the focus on humanitarian response and the expertise within that, given the focus on epidemics. So we've been doing work, and I'm using a very royal we term, mostly by all colleagues rather than me, but work around modelling of COVID-19 in low middle income settings, developing guidance on preventing COVID-19 and managing it in refugee and humanitarian settings, and also guidance directly with governments. And then touching on the point Claire mentioned earlier around interdisciplinary research and bringing in the social science research within RECAP to be exploring elements that have, I think, historically often been neglected in epidemic responses around trust, protecting vulnerable groups, some of the ethical issues, and given the huge impacts of COVID on economies and shifting of financing away from other health aspects towards COVID, we're planning some work around health financing. The key challenge will obviously be how we balance all these COVID related activities with still fulfilling our existing recap activities. So thank you very much for that. Thank you.
Thank you, Bayard. I'm sure there'll be a lot of questions about that. Our next speaker is Teresa Nunez. She comes from the Action Against Stunting Hub. Teresa is the Senior Hub Manager. She has over 10 years of experience working across a range of INGOs, from World Vision to Save the Children to Oxfam in the humanitarian space. She's had a number of senior roles supporting country offices and delivering effective programs and advising on operational capacity. And she's been involved in a number of large humanitarian responses, from Ebola to the El Nino drought response. And as I said, she's currently the Senior Hub Manager for the Action Against Stunting Hub. So welcome, Teresa.
Thank you, Claire, for the introduction. I also prepared a short presentation, so I will share my screen. I hope it works. I hope you can see the presentation. Yes, great, thank you. So this is a very short presentation, and it mainly is based on my previous experience and background working on international NGOs, as Claire mentioned. So it's from more a project program perspective rather than a humanitarian project and program perspective rather than a research program perspective. So these are just some of the, when I was developing the contingency planning for the Action Against Stunting, I started thinking of what are the key aspects and questions that we need to answer. So this is just basically the three simple questions: what is going to happen? So risk assessment, what we're going to do about it, response, and what can we do ahead of time to get prepared. The key principles of a good contingency planning is it has to be practical, simple and easy to do and to follow, realistic and feasible, needs-based, ensuring fair use of resources, is often a process driven for effective operationalization. It needs to be tested and regularly monitored and updated. So it's a continuum model. It can't be a static planning, contingency planning. So when I was developing the Action Against Stunting Hub contingency planning, I used the scenario base. So this we developed two scenarios: one on a 3-month delay and one of a 3 to 6 month delay, and the impact of COVID in these two scenarios. We mapped all the implications for staff, the study participants, the finance implications, travel, safety, and duty of care, etc. This was a very consultative process, so all the hub collaborators and country team leads were consulted. And we put together, and also the UKRI Global Charter Research Funds were consulted, informed during this contingency planning process. So the results was we mapped out all the hub response and strategy, and also the roles and responsibilities. So this means the activities that can be done while we are in lockdown, and because we cannot physically travel, what activities must stop, and the ones that can carry on, and the ones that have to be delayed further. One of them is the cohort recruitment. And also we have discussed and are still discussing what is the cohort recruitment criteria. And finally, you should be informed, consulted, and responsible in all of these stages. So it's a very simple mapping, but it's being shared with everyone. As I said, this will be regularly updated and monitored as the situation evolves. The communication channel has been very, very effective. So we're using our own project management platform, Glass Cubes. We post regular updates every week or every 2 weeks, so everyone knows where we are on this. There, as Bayard mentioned, there are a number of challenges and still and a number of questions that we face as we develop this contingency planning. One of them, the first one is how we develop an action plan in these times of uncertainty and dealing with uncertainty, and how to be agile and adapt to this constant change and evolving change. And this is not business as usual. How do we prioritize and engage, motivate the teams and all the collaborators? And another question and challenge that we face is the contingency plans are very hard to monitor. We have 3 country and 3 study sites, and each of them at different stages. It puts a lot of pressure on communication, reliance on external news sources, and also the recruitment, the criteria to start the recruitment of our cohort. We are establishing some of the key parameters, but again, this is evolving, and at some point we will need to make a decision on where to now and where to start. I'm very sorry, I have a dog barking right now. I'm very sorry for the noise. So this slide is basically just my personal, some reflections based on my experience of the humanitarian and research contingency planning. I work for Oxfam, and as you know, Oxfam is part of the Disaster Emergency Committee. The Oxfam is launched as well as the 14 organizations belong to DEC, their own appeal. This is just each organization has launched their own appeal. It's not a DEC appeal as yet. These funds will be able to support and prepare the communities to help prevent the spread of the virus. They do have a very strong focus on WASH, because they have a very large and international NGO. They have a global team ready to deploy and support. With a very, very strong campaign and advocacy work behind the scenes, which is very, very effective. But often the responses are not coordinated, and often the short-term response become a long-term response with very, very limited funding. My experience with research is I just joined the Action Against Stunting. I joined 6 months ago, but I found that the joint collaboration from the UK research councils and international research organizations was more reactive. So I started after the pandemic started, and often is very difficult again to work with uncertainty, and the expected results. We are hoping that they're going to be medium-long, but they can be long-term results. And as Bayard also mentioned, there is quite a very strong impact on ongoing research on other areas, and probably funding will be limited, or if not stopped, because of the focus on the ongoing COVID. So this is just my my very short presentation. Thank you for your time, and please do ask any questions. Thank you.
Thank you, Teresa, for that.
I'm very sorry for the background noise, Claire. Very sorry.
No, that's okay. My dog is probably going to start any minute as on cue, so don't worry, don't worry. Thank you for that. That was really fascinating, and it really brings us back from a different perspective. So our next speaker is Professor Jonathan Goodhand from SOAS. And he's a professor of conflict and development studies. His research interests include political economy of aid and conflict, NGOs and peace building, and post-conflict reconstruction. He's worked for a number of years managing humanitarian development programs in conflict situations in Afghanistan, Pakistan, and Sri Lanka. And he is PI of the Drugs and Disorder Project, which aims to find policy solutions to transforming drug economies into peacetime economies in the aftermath of war. So welcome, Jonathan.
Hi, thank you very much. And I don't have a presentation, but I'll say a few words about our project and about how we are kind of flexing and adapting to the new realities. Just a few words firstly about the project. It's called Drugs and Disorder, Building Sustainable Peacetime Economies in the Aftermath of War. And we're interested in this project in the role of illicit drugs in relation to the dynamics of conflict, of development, livelihoods, and health. And we aim in the project to reframe drug issues from ones of primarily law and order and criminality to one that's more concerned with drugs as a development and a human security issue. It's a GCRF project like this. It comes from the same cohort as Bayard's, and Bayard is actually a member and LS6GM are a member of this research as well. It's a big project, 12 partners, 4 years, and we're conducting research in 9 borderland regions in Afghanistan, Colombia, and Myanmar, so 3 of the world's biggest drug-producing regions. And we're conducting research in very fragile, insecure, and remote borderland regions. So this is a project, it's large, it's complex, involves international collaboration, it's comparative, it's interdisciplinarity, and it's working in areas that are very, very insecure and very difficult, on a very difficult issue. But when we did our risk analysis, we didn't include this in our risk analysis. Most of our risks that we were concerned about related to conflict and the ways that conflict and instability and also issues of criminality are likely to impinge on our researchers. So we weren't prepared for this at all. And although we have thought a lot about questions of risk. As the final thing to say is, like as Bayard mentioned with RECAP, we will be judged at the end of this project on our ability to have developed the capacity collectively of our 12 different partners. And I guess COVID has really kind of, there's a real challenge for us now about how do you do capacity building in these kinds of, in this kind of a new reality. So the 3 kind of dimensions and components of the project are its research, its capacity building, and policy engagement. So I want to say a few words now about how we're responding to COVID. And the first thing to say is, to a great extent, up till now, it's been largely reactive and kind of an organic kind of way of responding to things as they've hit us in the different countries and in the UK. But we're now in the process of forming within the project the COVID-19 research group to think more systematically about how we can work what I've called around COVID, and in terms of realigning our project to try and conduct research in this new situation, to flex the project. But secondly, also this question about working on COVID and actually including COVID as part of a focus of our research. So first of all, on this question about working around COVID, so reacting to it and adapting, it's happened differently in the 3 countries, of course, because they're different contexts. We have different partners there with different sets of capacities. Government's policies have been different and the health systems are very different in the 3 countries. And it's been an interesting conversation across the 3 countries with our partners about the differing kinds of risk assessments that are being made, the differing calculations, and understandings of the trade-offs involved in doing the research in this context. So in Colombia, there's been a very strict government lockdown. No research is taking place in our borderland regions. And in the shadow of COVID, what we found actually in a number of the borderlands, there has been a growth of violence, and including targeting of civil society leaders who we have been working with in the projects. There have been a growing uptick in assassinations, and also, interestingly, and very concerning to us, is there's been a growth in fumigation policies in these borderland regions. So COVID has interacted with the policy environments and the fragile conflict setting in concerning ways. So in Colombia and now also in Myanmar, all the research has gone on hold. In Myanmar, the government policy has been a little bit unclear, and the impetus for putting research on hold has come mainly from our partners, and they've closed their offices. And both in Myanmar and Colombia, they've used this period as an opportunity to kind of analyze, take stock of the data that they've already got. As with Bayard's project, there's been a lot of research now conducted over the last 2 years. So in a way, this is an opportune moment for us to concentrate on our data analysis and on our writing. Now in Afghanistan, there was a very different conversation going on, and it brought out quite a lot of the tensions and the issues around how you respond to COVID. In Afghanistan, our research partners really wanted to continue with the research. We'd spent a lot of time preparing for the next phase. And even though we were, Afghanistan's next door to Iran, and there was a growing concern about COVID. Our partners were very keen to continue, and it was quite a difficult but also an enlightening conversation. One of the things that was discussed in great depth was how the trade-off between health and the economy is quite different in these kinds of contexts. Afghan partners said, the assumption of this kind of advanced industrialized country model of lockdown and social distancing to protect the health service does not apply in Afghanistan, where there's really no health service to protect. And for us, the most important concern are questions around destitution and being able to survive. And so the trade-off that Afghans are making, are quite different. In the end, the government policy hardened. We consulted more widely as well with WHO and with senior management at SARS, and we felt in the end we had to put the research on hold. But in the meantime, we've been experimenting with different kinds of ways of continuing with research through telephone interviews, through an investment in GIS mapping, which is one of the big components of our research, continuing work on stakeholder mapping and so on. So there are a range of interim measures that can continue. And I think for the next 3 months, we're in a decent position to have a strategic pause in the project. In the UK, we're doing the same as has been mentioned already about relying on Zoom meetings. We had to cancel our international workshop, but we're looking at ways of holding that staggered over a longer period, including training and sharing of data, I think in quite creative and interesting ways, which I would agree with Bayard. There's opportunities here to rethink the way we work as researchers in this new environment. But moving forward, this uncertainty and where it looks very likely that the situation is going to continue for quite some time, and it's not going to be a 3-month pause. We're thinking very seriously about how we plan, and it's clear as countries move out of lockdown, it will happen very differently in different countries. The risk opportunity calculus will be different for different research teams. And it has real challenges for us as a comparative project, because it's clear that what can happen in different countries will be quite different. And this is in tension with our comparative agenda around trying to have similar methods, similar approaches, similar sets of questions across the 3 countries. Now, those are a few kind of thoughts about working around COVID, but now there's the more, I think, quite interesting but challenging question, which also Bayard has touched on, working on COVID-19. Now, we're not going to kind of reorient our project into a research about COVID. I mean, we have expertise in a certain area, and although there are pressures to kind of be moving into a more explicit focus on COVID, we have to be aware of what our capacities are, what the trade-offs are, and what the costs are. At the same time, we think it's really important to flex our project, because we have a responsibility as social scientists to engage with these issues that really touch on core themes in our research. And from our perspective, we want to bring out a borderland perspective much more saliently in these debates. How is COVID impacting on the lives and the livelihoods of people engaging in illicit economies in these borderland regions? How is it affected on their health and well-being? What does it tell us about how people negotiate risk and vulnerability? What does it tell us about changing state-society relations? And how do drugs markets get affected by these kind of dramatic kind of moments of rupture? And finally, what is the role of policy, and how are policies around COVID-19 interacting with other sets of policies that we're looking at in relation to drugs development and peace building? So I think I've gone on for too long, but we have ambitions to think about how we incorporate a COVID perspective into our next phases of fieldwork. But being aware of the trades and the trade-offs and the costs around doing so. The other area where we think we can, it's incumbent on us to do some thinking about our own practice as researchers, is think about research innovation in response to this crisis. and the methodological security and the ethical challenges that COVID presents us, and having an ongoing conversation within the project, and writing about how we have changed as a result of this. I think it's a very important thing for us all to be doing as researchers. So to be very conscious about how we can flex the project, and also writing and publishing on these issues. I mean, I think it's very clear that this experience is really going to be a stress test for our partnerships. You know, are our partnerships resilient enough? What can we learn from conducting capacity building in this kind of environment? And how will our international partnerships hopefully prosper and develop as a result of this experience? So that's really it about, I think we've got things we can do about working around COVID, and things that we need to do as researchers to work on COVID. Thank you.
Thank you very much for that. There's a lot of interesting points in there that I hope we have time to unpack in the discussion. Our final speaker, last but not least, is Dan Vink. He's from the UKRI GCRF One Health Poultry Hub. And Dan is a veterinary epidemiologist with a very unique background. He specializes in animal health surveillance, biosecurity, risk analysis, and epidemic preparedness and response. But he's worked across the NGO sector, the academia, consultancy, and private sector. He's currently the program manager for the One Health Poultry Hub. And the hub, and I'm sure he'll tell us much more about it, looks at how the rapid expansion of poultry production in Asia increases the risk of infectious disease, and why, and explores different processes and behaviors. So welcome, Dan.
Thank you, Claire. Sounds like you've done my introduction for me on the hub. Yeah, good afternoon, everyone. I think one of the disadvantages of, perhaps advantages actually, of coming last is that there's not that much extra that I have to add that hasn't been said before, so I'll keep things very brief. I have a sum total of 2 slides to share, so I'll share those now, have a look at those. So just a bit of background about the hub. As Claire mentioned, this is one of the dozen GCRF hubs that were launched last year, of which the stunting hub is another. And as Claire has already mentioned as well, that it's a hub with a strong One Health focus, but looking specifically at poultry production across parts of the world, and specifically in Asia, where production is increasing rapidly. Also with a view of better understanding risks for emerging infectious diseases, which, if we look at the next slide, I'll put that up now. If it goes. Just looking at areas in the world where we know that hotspots of diseases are existent, and that's in Southern and East Asia. That maps almost perfectly with areas in the world where we're seeing huge increases in the rate of consumption of poultry meat. So this is really the raison d'etre of our hub, and this is what we're researching. We work in Bangladesh, India, Sri Lanka, and Vietnam. We've got a total of 28 partner organizations, so it's a very large and complex hub, working across those different countries, and including partners in a number of other countries. So we're working very much with a focus on biological sampling, understanding poultry production systems, from backyard systems to small-scale commercial production to large-scale integrated commercial production, which differs in all of those countries but has similarities as well. Trying to understand those production and distribution networks and value chains in terms of how that informs or influences the risk of transmission of infectious pathogens, zoonotic pathogens, but also emerging infectious diseases and viral diseases such as coronavirus, actually. So the kind of work we're doing is fairly close and quite relevant to a lot of the corona work that's being done currently. And as such, I think, you know, the impacts that this disease or pandemic poses is especially relevant for us, but also presents opportunities in terms of utilizing our network for responding to this pandemic and looking into the future. In terms of how the pandemic has affected our hub, there's three areas really. I'll just say something very briefly. First of all, just looking at mapping the impacts. Secondly, identifying risks to the hub and our work. And then thirdly, just looking at opportunities, looking to the future. In terms of the first point, mapping the impacts, I think there's very little that I would say that Bayard hasn't mentioned or hasn't been mentioned previously. A lot of our work constitutes field sampling, field work in markets as well as in on farm. Obviously, that has all now ground to a halt. With indefinite sort of notice, we really can't go back into the field until the situation is normalized, and that may be some time ahead. The second area is how this pandemic influences on our hub productivity. We estimate at the moment about a quarter of our hub researchers are seconded or engaged with COVID-19 work, whether that's people in public health institutions that have been seconded to COVID responses, or researchers, lab people or modelers that are working directly or indirectly on COVID. So that's quite a big chunk of our people that are directly now sort of sidetracked onto COVID, resulting in quite a lot of lost productivity. Of course, there's the more indirect consequences in terms of productivity, which affects all of us in the sense that we are now at home and working in quite an altered environment. So these things all have their impacts. In terms of risks, well, one of the first things we did was slap up a risk register, which Claire mentioned, and I think Teresa's mentioned as well. And I think similar to what the other speakers have mentioned, insofar as we had anticipated that there would be problems with pandemics in our original risk register, this may have included sort of unknown diseases coming out of our animal populations, but of course we could not anticipate the scale and the impact of this specific incident and the event that we're currently in. So we developed a risk register specific for our current situation, but it's such a fast-moving thing that it's almost outdated before we've even started working on it. But areas in which we found that we have real risks or real impacts are on staff capacity, staff productivity, travel restrictions, the field work that we're doing, the sampling, as well as laboratory work, and then a more generic risk, but I think one that is very relevant and maybe increasingly so for all of us, is the uncertainties of dealing with the change situation in a post-COVID sort of world, which may extend to some of the real sensitivities that we're facing in our Asian countries in terms of being able to develop and undertake field research, field sampling, some of the consequences that might have on political decisions and decision making, and some of the impacts related to that. And I think secondly is what this whole epidemic or pandemic will do in terms of altering the funding landscape that ultimately also informs a lot of our work in terms of the prospects, potential and appetite for performing the kind of research that we're doing. The final point I'll just mention very quickly is in terms of opportunities, and I think given the hub that we have and the type of focus that we have, there's a lot of scope emerging now for COVID and COVID-related work. Now, obviously, that's not part of our original program, and we are keeping our objectives and our work program as much to our original specifications as possible, but inevitably we will be facing some pressure to incorporate or to add COVID-related research to the hub research that we'd already intended doing. So there's various options we're exploring in terms of being able to do that. Whether that may mean secondment of our hub people onto other projects working in this area, whether that might be integrating or incorporating some COVID-related work or coronavirus-related work into our current work packages, or thirdly, whether that might mean looking at and initiating different partnerships or research projects and acquiring additional external funding that might be able to leverage the network that we're building in this part of the world, which will facilitate the development of this kind of research. I'm going to leave it there, so I'll just stop sharing my screen and hand back over to you, Claire. Thank you.
Thank you, Dan. And thanks to, I'm sure everybody will join me in a big virtual clap. That was a really comprehensive overview of contingency planning, so thank you for that. I guess, are there any questions in the audience? I'm conscious of time. Alessia, have we got some questions?
Not at the moment on the chat box, but if you want to ask any question, you can ask directly to the speakers.
Okay, I have a question for the entire panel. And Jonathan, you mentioned this, you talked about it, and something that we're grappling on the stunting hub is, when do we start back up? You know, shutting down was almost comparatively easy in terms of the decision making around that, but starting back up, it's like, you know, yes, there are very different considerations across the hub. So can we take it in turn to talk about how people are thinking about starting back up? Because I'm sure everybody's in the same space right now. When do we determine that it's safe to go into the field? By whose criteria do we use? So who wants to start? Teresa, do you want to start? Because I know we talk about this on a daily basis.
Sure. As I mentioned briefly during the presentation, we are consulting with all of our collaborators and also with our country team leads on this question: how do we start up? Mainly because the duty of care of all our participants comes first. We can't compromise on any safety, on the safety of the participants. So we have been putting together a criteria to start up. This will follow various sources of information, the WHO, country-specific health ministries, specific guidance and guidelines around this. But at the moment, we are just planning to. We might be able to start up in July, but obviously this might or might not be feasible because we are considering all of these elements. It's very difficult, as I said, to manage this uncertainty, but we are definitely monitoring very closely and having daily, if not weekly, conversations with all of our stakeholders on this. Yeah, that's what I have to say.
Okay,
yes. Yeah.
Okay, thank you. Does it be Dan and Bayard and Jonathan? Do you want to have a quick what your hubs and what your research teams are thinking about in terms of starting back up again?
Well, it's a little bit of a question of just wait and see. We have to be responsive, but it's very difficult to really make any plans. Currently, we've pretty much extended or delayed until September at the very earliest. We were anticipating to commence our field work in April. So that's off now at least 6 months, but there's going to be differences between the countries as well. So it's a country-specific situation. We just need to be responsive. It's impossible from our perspective to really try to plan this too much. But it's very tricky because for us to be able to do our work, the situation in the field needs to normalize. People have to go back to their daily daily business, their daily routines, their daily habits. Otherwise, there's from a scientific perspective, no point in sampling. It's not going to be representative. And that may extend quite significantly beyond September or next January or whatever it is. And so we have to just accommodate that and just see where we are. There's no real answer to the question.
Bayard, do you want to come in on any of that?
Yeah, I think it's very similar. I mean, essentially, we will be led by, fundamentally by our partners and what they feel safe and comfortable with doing, and also following national guidelines and guidance on doing it. But absolutely, at the moment, it's very unclear what stage we're going to be able to restart our activities, and it's going to vary enormously on a country by country basis. And so I think we have to be pragmatic and flexible, but certainly I think having some kind of criteria that we need to develop to at least ensure that people are not feeling in any way pressured conducting research, and particularly field research, and reaffirming sort of basic standards and principles will be important.
Yeah, thanks very much for that. And Jonathan, what you mentioned is something that we fear, that the intra-country variability. It won't just be the country itself in terms of opening up. It'll be the actual field sites and these different sites, and what is appropriate in one site may not be appropriate in another site. And that becomes a huge contingency area question mark. So could you take us through a little bit more about your thinking on that?
Yeah, no, I think what's a very, very obvious point with COVID is we have to think beyond methodological nationalism. You know, this is not something that respects borders, and we have to think beyond the nation states. So, yeah, the country is going to open up at different speeds, but the different regions within the country are also going to open at different speeds. And this is not only going to be linked to COVID. We've already mentioned in Colombia, there's been complex kind of entanglements between COVID and conflict dynamics. So there's going to, I suppose, what is the process for deciding is the key question, not, when we open up, because that's unknowable, but have we got a process in place that allows us to make some kind of informed and ethical decision? I mean, in Afghanistan, it's clear that the western border regions where we're doing research in Nimroz, which borders Iran, is really a real hub. Nangarhar in the east is likely to also be badly affected, but Badakhshan in the northeast, which is a more remote region, is probably less affected. So, it's quite likely maybe Badakhshan may be possible earlier, but then it depends on a whole host of other things. So there's another thing to say here as well. We're going to have real complex conversations in which partners will have a very different idea about the risk and when it's time to go back than perhaps we will. And it mirrors these questions about ethics and security that we have, and about the ethics protocols with all the institutions, or we all follow and all actually subscribe to, but often those kind of ethical frameworks are more about protecting us rather than protecting our researchers in the field. And so there's, how do we manage those conversations? I think that's something that we need to think very carefully about, so that the research teams and individual researchers in different borderlands will have different perspectives on this. And how do we have those conversations that respect those issues, but also our institutions will have their own sets of kind of security interests, ethics protocols, and duty of care protocols as well.
Yeah, thank you for that. Okay, we've got some raised hands, and we've got quite a few questions that are coming up from the chats. Alessia, do you want to take us through those?
If Marina, you want to ask your question?
Thanks, everyone. Hello, I'll just say hello briefly. Hi, from Tomorrow Cities Hub. Thank you, super interesting. I had a couple of questions I put in the chat, but Jonathan's just touched a little bit on the ethical ones. So I think I'll choose to ask the question to Teresa. So you talked about kind of the difference and the difficulty in navigating uncertainty in the research community as compared to humanitarian sector. What do you think are the barriers? Because managing uncertainty is all about being adaptive, isn't it? So what is it about the research community, and bearing in mind that all of us work on these huge, very complex programs with, you know, lots and lots of partners, what do you think are some of the challenges we're facing in being nimble in this moment? Thanks.
Thank you for your question. I will try to summarize and based again on my personal experiences having worked for the international NGO and humanitarian sector. I think that one of the biggest differences is around the DRR, so disaster and response and preparedness strategies that most of the international NGOs have, and they do also. They are part of humanitarian networks such as the Spheres, such as the DEC, as I mentioned, the disaster committee, the disaster response committee. So this facilitates in a way this adaptation, because the NGOs would prepare in advance. It would have contingency plans put in place well in advance, and based also on unfortunately on some events such as the cyclone Idai, such as the El Nino or the Ebola response in West Africa. So that means one of the biggest differences. As I said, I just joined this very large and very interesting research project, the Action Against Stunting. And when the COVID-19 impacts start to become more and more invisible, I had this conversation with Claire around what can we do? How can we prepare? Because that was my natural instinct. How can we prepare for this? And we start developing this contingency plan almost immediately. So I think preparedness is probably one of the biggest differences, and also a research project often has fixed or results or milestones, and again, how can we adapt if we are shifting the focus of our intended research outcomes? So those are some of the questions that we're also facing in our. Sorry if I answer your question or not.
Yeah, no, thanks, Teresa. Opportunistically, just very quickly, one of my other questions was around adapting impact pathways and how we think about that, given the long term, particularly with these large, very complex programs, right? And I work in the evaluation space, so I'm always concerned about what does that mean for our evaluation designs, because it's GCRF, right? So the evaluation requirements are different. Anyway, I'll leave it there. Thank you very much. Really interesting.
We have another question from Shireen.
Hello, I'm a tiny bit nervous to ask this question. First of all, I should declare that I actually work with LIDC as communications coordinator. But the reason I'm asking this question, it's really aimed at Bayard, and it's because I happen to be half Sierra Leonean and half Lebanese. So I feel like I have a wonderful opportunity here to ask a question that I wouldn't often get to ask, because not many people work in both Sierra Leone and the Lebanon. So I guess I should start by saying kushe and merhaba. I don't know if you speak either of those languages or both. But yes, thank you for being here, doing this for us. Question I want to ask is, what is the extent of the influence that you have with people on the ground, both in, well, particularly Freetown, but in Sierra Leone and the Lebanon, as someone who has family ties in both those countries? It's impossible not to be very concerned at the mess that is the public health messaging that's happening in both those places, and the political events that are happening there as well. I guess you probably know that there was a huge riot in the main prison in Freetown I got the news yesterday, and we're told it was happening yesterday as I was being sent the messages. And apparently it was triggered because there was news that somebody had tested positive for COVID in a very overcrowded prison, and they basically set fire to Padembaro prison. People escaped. And also in Lebanon, we know that there's still people protesting. So there's basically, you know, messages around physical distancing and so on, just isn't happening, basically. There's also a lot of false messaging going around, which is really, really difficult to keep. It's exhausting constantly trying to push back against some of the misinformation that's going around via WhatsApp, and that people really take seriously in the absence of any, you know, voices that they listen to. So I wondered if you had, you know, something that you could say about that.
Yeah, I mean, the short answer to your question is really that we at the moment we don't have that much influence ourselves as researchers on these very immediate issues that have come up, like you say. So, I mean, through our partners, that would be the mechanism for doing that. And so the partners that
I didn't hear what you just said. That your partner.
The partners, for example, that we work with in Sierra Leone, based in the University of Sierra Leone at COMAS, the medical school, and working in the hospital. They also work closely with the Ministry of Health. So they have links to the government there that they could try and support, for example, more effective messaging. And similarly in Lebanon, on another project, we work closely with the Ministry of Public Health there, particularly with the National Mental Health Programme. And so through them, for example, with regards to mental health, we're in a strong position to be tackling some of the issues that you raise. So, for example, attacks on health workers, and discrimination and stigma against health workers for fear that they are somehow spreading COVID. So it's a kind of perhaps a very different perception of health workers an attitude to health workers that we're seeing, for example, here in the UK. So through our partners there, we're in a sort of position to help be working with them on addressing some of those issues. But I think the broader point you make is really important as well, is that COVID is not happening in a vacuum. It's happening in really complex settings with lots of other really difficult situations going on. Jonathan raised this in his presentation as well. But if we think about Lebanon, for example, with huge political protests that have been happening since October, financial meltdown of the economy. So it's a really delicate time. And then when you impose on that the fear of COVID, outbreak of COVID, and then the lockdown and all the political risks and fear that come with that, it's a really challenging environment. And so it's not just COVID that we're having to respond to, it's all of the other challenges around that, which our project's already been impacted by the events in Lebanon. So I think it's a really important point that you raise about all these other things that are happening that we also need to be aware of. Yeah.
Thank you. I wish there was an easy answer, but yeah, thank you.
All right, thanks very much. Alessia, are there any other audience? We have time for maybe one more question.
Yes, we have a question from Jay, and she is asking to Professor Bayard that you mentioned the pressure on researchers to reorient research to focus on COVID. So to what extent has RECAP shifted to focus on COVID, and what are the implications of this on the original project objectives?
Yeah, thanks for that, Jay. So I think, and I should, in a way, this comment that I made about researchers feeling that pressure wasn't in relation to RECAP, but it was perhaps I'm feeling it from colleagues in the department that I work in. And I think but anyway, with regards to RECAP, there's been some reorientation that's been absolutely kind of voluntary from people working in RECAP to think about how their work within RECAP could be reoriented to support COVID responses. I think for them and for the project as a whole, it was relatively easier compared to perhaps many other projects because so much of our work was broadly aligned to the types of events that we're seeing with COVID. So we have a work package specifically on epidemic modeling. So it's very logical and right that they should reorient to responding to COVID. Similarly, a lot of our work is based on sort of case study approaches. And so it's quite easy to reorient a case study towards a new topic like COVID. I think the key thing that we've been trying to ensure is ensuring that where we've been reorienting it, it's still very much aligned with what we wanted to do originally in ReCap, and very much aligned with the different work packages that I mentioned earlier. So there's a very clear sort of logic and rationale for why that work on COVID is linked to that particular work package and why those staff should be working on it. And that hasn't been, I don't think it's been that difficult. And I mentioned earlier that a strength and a weakness of ReCap is its diversity. But in the case of responding to COVID, it's been a strength in that it's given us the flexibility to legitimately respond to those activities. In terms of the actual proportion of staff time, I couldn't tell you that.
Okay, great. Thank you very much. I think I'm very cognizant of time now. I'd like to really thank our speakers today and our audience for joining us. I think it was a really interesting kind of overview of all these different issues, and I'm really grateful for that. So thank you very much.